Lindsay.
Hi there.
We're here to do the physical exam now, okay?
All right.
So, just to get a couple of things out of the way, how tall are you?
5'5".
And how much do you weigh?
175.
175, okay. And when you first came in today, we did your pulse, which was 68. Your respiratory rate was 15. Your temperature was 98.6. And your oxygen saturation was 100%, so that's all normal. I'm now going to take your blood pressure. Good. 115/82. So that's okay. And now I'm going to just start the physical exam, starting from your head all the way down to your toes, and I'll be talking, touching, and looking at various parts of your body, okay? So to start out, I'm going to be looking at your head, your skin, and your nails. Your hair, skin, and nails, sorry. So when I look at your hair, I'm just going to take your hair down for a second. I'm looking at the distribution. I'm looking at the texture, which is normal. I'm looking at your scalp. I don't see any infestations. I don't see any red lesions, dry patches, or any dandruff, okay? Try to put your hair back up here as best I can. And now I'm going to just look at your back here for your skin assessment. I'm looking for suspicious moles, redness, rashes, which I do not see. Your skin is pink, warm, and dry. Coming down here around to the front. Again, I'm not seeing any suspicious moles, lesions, or rashes. Your skin looks normal. Just going to button this up for you. Coming down to your arms, again, no suspicious moles, no rashes, dry patches, nothing. Your skin is healthy and normal. I'm coming down to your nails, and I'm noticing that you have a normal cap refill, that your nails are healthy, and there's no clubbing or cyanosis noted, okay? So now moving on to your head and neck. I'm going to have you just move your head around like that. Do you have any pain when you move?
No.
No, okay. So I've noticed that your head is normal cephalic, your facial features are symmetric, and I'm noticing that your neck is symmetric and there's no issues there, okay? I'm going to just palpate your temporal mandibular joint. I'm going to have you open and close your mouth. Do you have any pain?
Nope.
Okay, and I did not feel any clicking. So moving right along now, we're going to look at your eyes, your ears, your nose, and your throat, okay? So a couple of things that I want to get out of the way is to note that we did a Snellen visual acuity test when you first arrived, where you stood 20 feet away and you looked across the room and you covered your right eye and then your left eye and then with both eyes. And your right vision was noted to be 20/20, your left was 20/30, and both were 20/20, so perfect normal vision. Do you have any eye pain?
No.
Do you have any vision issues right now? No, okay. So looking at your eyes, they are symmetric. I can see that your sclera is white. I don't see any exudate, inflammation, signs of infection, or anything like that. I'm coming here and I'm just going to pull your lid down. I'm looking at the conjunctivi, which is pink and moist, and I'm looking for any styes or any abnormalities, which I do not see, okay? So a couple of tests that we're going to get out of the way. One is a conversions test, and you're going to just look at my finger. Good. So that's normal. And then I'm looking for any abnormal extraocular movements when I do this exam. This is the 6 cardinal movements, and you're going to just look at and watch my finger here, okay? Good, so that is normal, okay? So now going on to the light here, I'm going to do just an external exam with this light, and then I'm going to move on to the fundoscopic exam, okay? So looking at your iris here, I notice that it is clear markings. There is no protrusion. I'm also noticing that your pupils are equal and reactive to light, and they accommodate appropriately, okay? So no abnormalities there. And then I'm going to get a little bit closer with the fundoscopic exam, okay? And I might just have to lift your lid a little bit, but we'll see. You're going to look straight ahead. Okay, so I can see the red reflex, and I can visualize the retina and the vessels. They are normal color and size, and the optic disc is normal as well. Moving over to this side. Same findings, normal retina and vessels, normal optic disc, and a red reflex. So that's all normal, okay? Okay, so moving on now to your ears. Again, they are symmetric. Do you have any recent ear pain or infections? Nothing like that. I notice that you have some piercings, and they are normal in color. And I'm just going to palpate the tragus here. Do you have any pain? No. And then the auricle, do you have any pain? No. Okay. So examining your ears, they look normal. There's no inflammation, redness, or drainage that I can see. Looking a little bit closer, I'm going to pull up and back on the auricle here. And the canal is clear. I can visualize the eardrum. It is in neutral position, and it is in a pink-gray color, which is normal. No bulging, no exudate, no signs of infection. Up and back again on this side, clear canal. Eardrum is in neutral position, and it is in a pink and gray color, which is normal. So your ears look good. Okay, I'm going to just perform a whisper test where you cover your left ear, and I whisper in your ear, and you tell me what I say. And then I do the same thing on the other side, okay? So if you can cover your left ear.
W, X, Y, and Z. A, B, C, Q, R, S.
Good. So your hearing is intact, and I'm noticing that you're speaking to me in a normal tone of voice, okay? So moving down into your nose, you said you did not have a deviated septum. I'm going to just examine each nair here. It is clear. I don't see any drainage, dryness, or redness, anything that would be abnormal. So that looks good. I'm going to just palpate your frontal sinuses here. Do you have any pain when I touch? Nope. And your maxillary? Nope. No pain. Okay. So moving on now to your mouth, okay? I'm going to use the light, and I'm going to just have you open your mouth. I am noticing that the mucosa is pink and moist. I don't see any lesions or canker sores. Your pharynx are visual, present and without exudate. Your dental work is also present, and I don't see any evidence of new cavities, infections, or anything abnormal there, okay? So I'm going to have you just, I'm going to depress your tongue here. You're going to say ah, and I'm just going to visualize the pharynx in your soft palate here. Say ah. Good. I see the soft palate rise and fall, and I see that the uvula is in a neutral position, all normal. And then I'm actually going to just look under your tongue really quick. Good. And I don't see any lesions, signs of cancer, or any abnormalities there. So that is normal, okay? Moving on now to your neck, okay? So again, I notice that you have symmetry. There's no obvious distension or swelling anywhere. I'm going to palpate your lymph nodes, and you're going to tell me at the end if you have any tenderness, okay? Pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I did not feel any abnormal lymph nodes. I actually didn't feel any lymph nodes, so that's normal. Did you have any tenderness? No. Okay, perfect. So now I'm going to take a look at your trachea here, and I'm going to have you just tip your head back if you can. Okay, I'm noticing that the trachea is midline, And I'm going to have you swallow. Good, and I can see the thyroid nodule move up and down when you swallow. I'm going to come around here and I'm just going to feel your thyroid. I'm going to displace everything to the right. You can swallow. Good, I'm going to switch. Do it again. Good, okay, so your thyroid gland feels normal. Do you have any pain? No, okay. So moving now onto your thorax and lungs here, okay? I've noticed that you've been taking normal breaths. Your respiratory rate has been even and non-labored. You're speaking to me in an unlabored fashion, in full sentences, all normal stuff, okay? So I'm going to actually come around on the other side here, and I'm going to I'm going to feel your chest here. And I'm feeling for any crepitus, which would be abnormal air, feels like a popping sensation, which I do not feel. And then if you can just bring your legs around, I'm gonna actually just, perfect. I'm gonna just do some percussion back here, if you're comfortable, in all the lung fields. And I'm listening for resonance, which is normal. Dullness would indicate fluid-filled areas or mass, which I do not hear. Just gonna pull this down a little bit. Same thing here. And if you can just move that arm to the side, I'm just gonna scoot in here. Good. Same thing over here. Good, okay, so that is normal, okay? We'll snap you back up. And now I'm going to listen. Just take some breaths in and out. Again. Good. Clear lungs bilaterally. I'm gonna just listen in the front here, same thing. Good. Just gonna come around here. Good. Again, your lungs are clear in all fields, so that's normal. And now I'm going to talk to you a little bit about the self-breast exams. You have a strong family history of breast cancer. You can lean back if that's comfortable. And I just want to make sure that we're talking about incorporating this into your monthly routine so that you can get really comfortable with what's normal, okay? So a few things that you're going to want to do just after a couple of days of your menses, you're going to stand in the mirror with your arms by your side and you're going to examine your breasts. You're going to be looking for changes, including asymmetry, nipple drainage, redness, any kind of swelling. And then you're going to stand and do the same thing with your arms on your hips, and then your arms either out to your side or up over your head, okay? So you want to get to know what's normal, okay? And then you're going to lay in a comfortable position. You're going to put one arm over your head. So let's say it's this arm. You're going to put this arm over your head. And with that arm, you're going to move in a circular direction, covering your nipple and all your breast tissue, all the way around, coming right up under your axillary, which is your armpit, and palpating those lymph nodes for any tenderness or swelling. Then you're going to do the same thing with your arm down. And then you're going to switch sides, okay? So that will be something that you really need to start doing because, like I said, with the family history and stuff like that, you'll get to know what's normal and you can let someone know that needs to know if something pops up that's abnormal, okay? So now I'm going to look at your neck and your vessels here. I'm just going to pull this down so that I can examine a little bit closely. And I'm going to look with tangential lighting. And I'm looking for any jugular vein distension, which I do not see. And I'm going to palpate your carotid here for any thrills, which I do not feel. You have a normal, strong carotid pulse bilaterally, okay? And then I'm going to just examine your PMI, which this is going to come up. And I'm actually going to just put my hand there for a second and I can feel your PMI. And then I'm going to look, and I'm looking for just a brisk tapping, which I can see. That looks normal. Now I'm going to listen to your heart sounds, okay, with the diaphragm of my stethoscope. I'm going to start at the second intercostal space, just to the right of the sternum, and then onto the left side, right down the sternal border here, and back to the PMI. I can hear both S1 and S2, and your heart sounds are strong and regular. Very good, okay, and now I'm going to switch this to the bell so that I can pick up any abnormal heart sounds, including murmurs, which you said you did not have a history of, right? Same pattern here. Good. I do not hear any abnormalities or any murmurs, okay? So moving on down to your belly or abdomen area. I'm going to just pull this up so that I can examine your belly. Okay. And when I look at your belly, I don't notice any, I'm actually going to put you down a little bit so I can get a better view, if you don't mind. Is that comfortable? Okay. So I don't notice any distension. I don't notice any hernias. I do notice that you have some scarring here, stretch marks, okay? And I can visualize your appendix scar and your cesarean scar, which are all normal and healing well, okay? So I'm going to just listen first in all 4 quadrants. Good, normal, active bowel sounds, okay? And now I'm just going to be percussing all quadrants here. I'm listening for anything abnormal, like hypertympanic sounds, which I do not hear, okay? And now I'm going to palpate lightly and then a little bit deeply, and you let me know if you have any tenderness here. Any pain? No, okay, a little bit deeper. No discomfort, okay. And then I'm just gonna do a quick rebound. Any pain? All right, and now I'm going to attempt to palpate your liver. You can take a deep breath. Okay, which I do not feel the edge of the liver, which is normal. That means it's a normal size. It's not enlarged at all, okay? Why I'm here, I'm going to be palpating your inguinal lymph nodes here. Same thing over here. Any tenderness? I do not feel any abnormalities. I'm going to be palpating your femoral artery. Good, strong, regular. And then I'm just going to put my hand here and I'm going to have you tuck your head up and cough for me. Good, no signs or feelings of a hernia. Good, okay, great. so that feels good. I'm going to help you just sit up here. And I forgot one thing when I was looking at your back. I just want to see if you have any CVA tenderness over the kidneys. So I'm just going to do a quick exam back here. Any pain? No. Okay. Good. Okay. So moving on now to the musculoskeletal system. If you want to just bring your legs around, that's fine if you're comfortable doing that. Okay. So I noticed that your muscles are symmetric. I don't see any joint swelling. I haven't noticed any obvious stiffness. Do you have any pain? Do you have, you feel like you have normal range of motion? Okay. And so now I'm just going to be checking the rest of the pulses that I didn't get to. I'm going to be palpating your brachial. Watch here. Can I take that off so I can just get your... The popliteal here. Good. Your anterior tibial. Your dorsalis pedis. Coming around here, same thing. Anterior tibial, dorsalis pedis. Popliteal. Radial, and brachial. All +2 equal and normal, okay? So that's all good. And now I'm going to just do a couple neurological tests and then we'll be just about done, okay? So I'm going to be testing your muscular sensory system, excuse me. So I have a couple of things over here I'm going to be using that will indicate sharp and soft. But in the meantime, I want you to tell me where, I'm going to have you close your eyes and I'm going to touch different parts of your body and you're going to tell me where I'm touching you. So can you just uncross your legs? Okay, so close your eyes.
Shin. Left shin. Left forearm. Left upper arm. Right upper arm. Right forearm. Forehead.
Sorry. Okay, good. So you're so far your sensory is intact, and now you're going to close your eyes and you're going to tell me whether this is sharp or dull or soft. Okay. Okay.
Soft. Sharp. 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 Soft. Soft.
Okay. Good. So that's intact. That's all normal. And now I'm going to have you. I'm going to be testing your deep tendon reflexes here. Okay. So your arms, your knees, and your the back of your feet. Okay. So you're just going to relax your arm here. Can't get a good spot because you're. There we go. Good. And then I'm going to come around and do this side. Okay. And then I'm just going to have you beat just a little bit. And over here, just bring your foot up a little bit. Okay, so that's all normal. And now I'm going to have you, I'm going to just test your grip strength here, okay? So you're going to just push against me and then pull me towards you. Good. And then lift your leg. Good. Good. Squeeze my fingers. Good. So your strength is intact bilaterally, and now I'm going to have you, I'm going to just do a couple quick cerebellar function tests. I'm going to have you stand up. I can tie you so that you're comfortable here. And I'm going to have you just walk down and back as best you can. Yeah. Good. I'm noticing that your gait is normal and steady. And now I'm going to have you just walk back heel to toe. Good. Again, normal and steady, perfect. Okay, and then I'm going to have you just stand diagonally here. I'm going to have you put your arms straight out, close your eyes. Okay, I'm just testing for any swaying. This is called the wrong bird test, which is normal. Okay, so your sensory function is intact. And I think that's it for today. Overall, a very healthy, normal exam, okay?
All right.
So thank you so much.
Thank you.